Hi, I'm Shelley Zieroth, a heart function cardiologist from Winnipeg, Canada, and I'm here to talk to you really briefly about the DARE-AF trial. This is recently published in Circulation, and it was a very interesting trial concept. We know from other studies with SGLT2 inhibitors in patients with type 2 diabetes, CKD, as well as in heart failure, that there's an association with less atrial fibrillation occurrence. So this randomized controlled trial enrolled 200 patients who were planned to have an atrial fibrillation ablation without an indication for SGLT2 inhibitor. So it excluded patients with type 2 diabetes, heart failure, and CKD. And it tested the theory as to whether or not the use of Dapagliflozin after AFib ablation for a course of 3 months would reduce the recurrence of atrial fibrillation. Secondary endpoints include left atrial dilatation as well as functional status. Well, 100 patients in each arm, AFib ablation occurs, they get randomized to Dapagliflozin versus placebo for 3 months, and the trial did not find any significant difference in the rate of AFib occurrence. In fact, it was about 30% in each arm, so no impact of Dapagliflozin. And furthermore, there were no changes in LA size or in functional status in this very brief trial in patients who did not have another indication for SGLT2 inhibitor. So in a randomized trial, no role for Dapagliflozin in this patient population thus far.